Did you know that 1 in 3 people will develop cancer in their lifetime? Here's something most people don't realize. Every year, millions of cancer cases are diagnosed too late simply because the early warning signs were missed. According to the American Cancer Society, detecting cancer at stage 1 can lead to survival rates above 90% for many common types. But if you wait until stage 4, that rate can drop to below 20%. In the next few minutes, I'll highlight 8 subtle warning signs that could potentially save your life. These aren't the obvious symptoms everyone has heard about, they're the quiet, early signals your body gives before things become serious. Unfortunately, these signs are often overlooked. Yet they could be crucial for early detection. You might be thinking, if I look up every ache and pain online, it'll all sound like cancer. That's exactly why this information is different. I'll focus on scientifically backed signs, not overhyped internet rumors. These are the same indicators that have helped countless people detect cancer early, when treatment is most effective. Stay with me, because this isn't about spreading fear, it's about equipping you with knowledge that could genuinely make a life-saving difference. And since this topic is so essential, I've also put together 2 additional in-depth videos that you might find helpful afterward. And before we start, don't forget to hit that subscribe button and turn on the notification bell so you never miss out on more tips to keep you healthy and active. Let's get started. 1. Bone pain. One of the most commonly overlooked warning signs of potential cancer is persistent bone pain. Unlike temporary discomfort from exercise or minor injuries, cancer-related bone pain typically intensifies over time and often worsens at night. When cancer originates in or spreads to the bones, it disrupts the normal bone tissue structure, causing a deep, penetrating ache that becomes difficult to ignore. Primary bone cancer, medically known as osteosarcoma, usually affects the long bones in the arms and legs. Initially, the pain might feel mild, resembling a sprain or muscle ache, but it progressively grows more severe and unrelenting. This can have a significant impact on daily activities, as even simple movements may become increasingly challenging. Some individuals describe the sensation as a constant throbbing or aching that does not respond to typical pain relievers. If you notice persistent bone pain accompanied by swelling, increased tenderness, or unexplained fractures, it is critical to seek medical attention without delay. Early detection of bone cancer plays an essential role in improving treatment outcomes, with survival rates being significantly higher when the condition is diagnosed at an early stage. 2. Eye pain. Your eyes can provide vital clues about your overall health, including potential signs of cancer. Ocular melanoma, though rare, is the most common primary eye cancer in adults. Its symptoms often begin subtly but may progress to more noticeable changes that should not be ignored. When cancer develops in the eye, it can cause unique symptoms that differ from typical eye issues. These may include persistent blurred vision that doesn't improve with new glasses or unexplained flashes of light unrelated to migraines. A particularly concerning sign is the appearance of a dark spot on the iris that gradually changes in size or color. Advanced imaging techniques, such as an ophthalmoscope, allow doctors to examine the internal structures of the eye for abnormalities. Individuals with lighter-colored eyes or fair skin face a higher risk for ocular melanoma. Persistent eye pain or vision changes should not be overlooked, as early detection can help preserve both sight and life. Regular eye exams are especially important if you have risk factors like prolonged sun exposure or a family history of eye cancer. 3. Body rash. When it comes to skin changes, certain types of rashes warrant immediate medical attention. Leukemia, a cancer that affects blood-forming tissues, can present with distinct skin symptoms that are often mistaken for minor conditions. The key difference lies in how these rashes appear and behave. One such symptom is petechiae, tiny, round spots on the skin caused by platelet deficiency, a common feature of leukemia. These spots usually measure 1 to 2 millimeters in diameter and do not blanch or fade when pressed. Their color can range from red to purple or brown, and they often cluster in areas subject to pressure, such as around the ankles or tight-fitting clothing. Understanding the mechanism behind these spots is crucial. Leukemia disrupts the body's ability to produce healthy platelets, which are essential for preventing bleeding. In the absence of sufficient platelets, tiny blood vessels known as capillaries may leak, resulting in these characteristic spots. Unlike typical rashes that might fade or itch over time, leukemic rashes persist and are often accompanied by other concerning symptoms like unexplained bruising or bleeding. 4. Fingernail marks subungual melanoma. A form of skin cancer called subungual melanoma, which develops beneath the nails, often begins as an innocent-looking streak. This dark line, medically referred to as melanonychia striata, runs vertically along the nail and requires careful monitoring. Unlike typical nail pigmentation, cancerous streaks usually appear suddenly and continue to evolve over time. The thumb and big toe are the most common sites for subungual melanoma, though it can develop on any nail. What makes this condition particularly dangerous is its ability to be mistaken for normal nail trauma or a fungal infection. Key warning signs include a dark streak wider than 3 mm, variations in color within the streak, or blurred edges. Understanding the Hutchinson sign is also important. This occurs when the dark pigmentation extends beyond the nail, spreading onto the surrounding skin. If you notice any changes in your nails, especially those accompanied by pain, nail splitting, or bleeding, it's crucial to seek medical attention immediately. 5. Unexplained night sweats. Night sweats that soak your bedding and nightclothes may signal something more concerning than a warm bedroom. When these episodes occur repeatedly and aren't linked to environmental factors or menopause, they could point to an underlying issue such as lymphoma. Distinguishing between normal sweating and pathological night sweats is essential. Night sweats associated with lymphoma typically occur alongside other B symptoms, which are considered significant in cancer diagnosis. These include unexplained fever and weight loss, forming a recognizable pattern of concern for oncologists. In cases of cancer-related night sweats, the body's immune system works overtime to combat cancer cells. The sweating mechanism is tied to your body's inflammatory response. As lymphoma affects the lymphatic system, it triggers the release of chemicals that can interfere with temperature regulation. While occasional night sweats due to illness or stress are normal, persistent episodes that leave you drenched should be evaluated by a medical professional. 6. Persistent heartburn. Persistent heartburn, or chronic acid reflux, medically referred to as gastroesophageal reflux disease, GERD, might seem like a minor inconvenience. However, if it continues despite lifestyle changes and medication, it could indicate a more serious underlying issue. One potential concern is esophageal cancer, which often begins with persistent acid reflux that doesn't respond to conventional treatments. The link between chronic heartburn and cancer stems from repeated damage to the lining of the esophagus. Over time, stomach acid can cause cellular changes in the esophageal lining, leading to a condition called Barrett's esophagus. This precancerous condition significantly raises the risk of developing esophageal adenocarcinoma. Be alert to warning signs, such as difficulty swallowing, the sensation of food getting stuck, or unexplained weight loss accompanying your heartburn. If you've been relying on over-the-counter medications for heartburn for more than 3 weeks without noticeable improvement, it's essential to consult a healthcare professional. 7. Jaundice. Jaundice, characterized by yellowing of the skin and eyes, occurs when bilirubin builds up in the body. While jaundice can stem from various conditions, its sudden onset in adults often signals a serious concern, such as pancreatic or liver cancer. In cases of pancreatic cancer, tumors may block the bile duct, preventing bilirubin from being properly processed and expelled. This blockage leads to bile entering the bloodstream, resulting in yellow discoloration of the skin and the whites of the eyes. Initially, these changes may be subtle but tend to become more noticeable as the condition advances. Due to the pancreas's deep location within the abdomen, detecting pancreatic cancer at an early stage can be challenging. Therefore, recognizing jaundice, particularly when it is accompanied by symptoms like upper abdominal pain, dark urine, or pale stools, is critical for timely medical evaluation. 8. Fever: a persistent or recurring. A persistent or recurring fever that lacks a clear explanation might be your body's way of signaling blood cancer. Unlike common fevers that resolve within a few days, cancer-related fevers often follow distinct patterns and may be accompanied by other systemic symptoms. Conditions like leukemia and lymphoma can activate your immune system to release chemicals known as cytokines, leading to frequent fevers. These fevers may occur without an apparent infection and are often paired with symptoms such as night sweats or unexplained weight loss. One characteristic pattern of these fevers includes temperature spikes at regular intervals, a phenomenon referred to as cyclic fever. If a fever persists beyond 2 weeks or repeatedly returns without a clear cause, it merits medical investigation. Blood cancers often impair the immune system, increasing vulnerability to infections while directly contributing to fever episodes. Proper evaluation typically involves blood tests to check for abnormal cell counts and other indicators of disease. Early detection significantly enhances cancer treatment outcomes. While these signs do not necessarily indicate cancer, they should be evaluated with appropriate medical attention. Thank you for watching this video. If you found it helpful, consider giving it a thumbs up and sharing it with others who could benefit from this information. Don't forget to subscribe to our channel for more valuable health content. We also think you'll find the video currently on your screen equally insightful.